good afternoon, and good evening from where depending on wherever you are. I am Alejandro Salicrup from the Center for Global Health at the National Cancer Institute of the National Institutes of Health. And I welcome all of you to this pre-application webinar for the recent announcement from NCI on Global Integrative Oncology Research. I'm going to share my slides and okay. Can you see? I hope you can see them all. I already have the privilege of talking with many of you that has been either email me or calling me, or we have discussions of what is the scope of this award and the things we need to emphasize. Based on that, we prepared this presentation that we hope will be helpful to all of you. We will start with the definition that we are currently used for integrative oncology. What are the goals and the research objectives of this announcement? And provide you with a few examples of potential responsive proposals. And then we will discuss some relevant details, including deadline, budget, how the research strategy should look, and review with you some things related to the submission and the eligibility, as well as the review criteria that will be used. Most importantly, we want to have a good chunk of time. Sorry, one of my dogs got excited about this funding opportunity as well. So we want, as I was saying, we want to have a good chunk of time to discuss any questions or further clarification that you might have. And I would like to take to this opportunity that here with us here today is Dr. Mark Parascandola. He's the Chief of the Research and Training Branch at the Center for Global Health, and he will be available also with me for any questions or any clarifications that you might need. So integrative oncology, as many of you know, and this is a definition by Witt et al. In the JNCI monograph 2017, it's a patient-centered, evidence-informed field of cancer care that utilize different practices, include mind and body practices, natural products, lifestyle modifications, that they could be from traditional medicine or complementary medicine, and they are used alongside conventional treatments. The main goal here is to optimize the health and the clinical outcomes across the cancer continuum, and more importantly, to empower people to prevent cancer and also to become important actors and participants before, during, and beyond the cancer treatment. So as you see, the main scope here is the patient participating in a very active way. This notice of special interest, as in everything at NCI NIH, we abbreviated and we call it NOSI, is the main aim here is to provide an opportunity for supplement funding to active and eligible NCI funded grants. This was a question that I received before during these past 2 weeks. It has to be an NCI funded grant, not from other institute at this time. And these administrative supplements are intended to support NCI funded investigators with the aim also that they leverage existing or maybe develop new partnerships with different researchers and stakeholders in low and middle income countries. Because what we want to look here, as we saw in the definition, is that we want to conduct research that would help us better understand what is the interface between Western or conventional biomedicine and traditional medical systems and complementary medicine. In terms of the research objectives is, we would like that it seems to address gaps and challenges and perhaps potential opportunities pertaining to the cancer care in low and middle income countries, particularly areas like reducing the symptom and treatment side effect burden, improving the patient quality of life, also to improve the tolerance and compliance with the standard oncological therapies, and improve in an objective way the assessed tumor response to standard oncological therapies, and importantly, improve cancer patient survival. So in terms of the responsive proposals, this is just a list of examples. It's not a comprehensive list in any way, and as I discussed with many of you, if there's other areas that are not included in these examples that you want to propose and that is within the scope of the parent grant, you can do it. But just to share with you a few examples for the pharmacology of TCAM. TCAM, we use it for traditional complementary and alternative medicine agents with a focus on the standard treatment. In other words, what is the interaction? It could be positive or negative. That type of pharmacology research, will be well received. The characterization of phytotherapeutic agents for global health, again, with a focus on interactions with the standard cancer treatment, and the interaction could be either positive or it could be negative. Also, let me go back one. And also, we would like to see that studies of integrative oncology on palliative care, where it's so important, and for the symptom management of different cancers. And I should say here, because that was another question that came, that it could be any type of cancer. We are not restricted to one specific type of cancer. Okay, so our other examples that of potential responsive proposals could be integrative oncology approaches to increase the tolerance and improve not only the physical, but the psychological recovery from cancer therapy, with a goal of increasing the adherence to a standard cancer treatments. And this is important. This happened in high-income countries, but it happened a lot in low and middle-income countries, that a person is in a treatment and is diagnosed and has to follow some protocol, and then they decide to go better by the traditional medicine. And perhaps in this type of research, since we are combining both methodologies and practices, might help to that the patient keep its adherence to the different cancer treatments. Research related to physiological effects of traditional complementary and alternative medicine, but also psychological effects are welcome. Research related to the use of TCAM to enhance the medication or the tolerance to pain during the standard cancer treatment also is something that will be of interest. Implementation science to study barriers and facilitators of the integration of TCAM into healthcare system. This is also important because we have several countries now that they are trying to integrate these traditional medicine practices or complementary medicine integrated to conventional cancer. But you know, they keep being, and in many countries, including low and middle income countries, they have universal systems, and this will be of great advantage. But in general, the policymakers, ministries or so, they are asking for more data. So research in this kind, I believe, or we believe it would be important. The same that studies that look at the integration of TCAM with standard biomedical or oncology approaches, and look at the implementation strategies to promote either the adoption or the integration of evidence-based cancer control interventions for cancer control. So as I mentioned, these are just examples of responsive proposals, and others would be considered, you know, but it has to be related to the parent grant, and we encourage you to discuss with us. Okay, let's go to, okay. In very important details that we want to remind, the applications, they should have to include studies of the integration of TCAM into conventional treatment in low and middle income countries. And the low and middle income countries investigators, we would like to see that they are engaged at all stages of the project or the study, from the design to the implementation and dissemination. I think here it's an important, it will be an adequate time to mention that, you know, in general, we consider low middle income countries based on classifications like the World Bank and others. But in this particular case, we decided to be more open in the sense that we will allow economies consider upper middle income to participate here. And one of the reasons for this, as you know, we had been all going through the world with this pandemic, and not only in terms of the health and people sick, but also the economies of many of these countries has changed, and the support for research, you know, is trying to get back to what it was. So we believe that, you know, we enhance it and give it the opportunities to all types of low and middle income countries, including all those that are considered upper middle economies. The expiration day, important, May 15, 2022. The budget also, it's 125,000 in direct cost. It shouldn't exceed that, and this is for the entire period of the application, with this 1 year. Okay, in terms of the research strategy, this is something that we have discussed with some of you. We are asking for 3 pages, no more. you should summarize the activities of the parent grant, but describe how the activities that you are proposing in this supplement will enhance or augment the activities of the parent grant. You also, we expected that you also describe very well what is the purpose of this supplement, how it relates to the parent grant, you know, that is within the scope, and what is the value added that provides to the parent grant. Also, it's important, since this is a global health study, that you describe the proposed global population and or data and how you will get access to it. This will be very relevant for us. And also in the global integrative research question that you want to investigate, you have to explain, you know, about the inclusion of the low and middle income countries population or the data of these countries and how it will be advance the understanding of integrative oncologies or potential intervention to address this field. In terms of the application submission and eligibility, just quick reminders, this I have discussed with those people that have approached me already. Again, it has to be within the scope of the parent grant and consistent with the original objective proof. You will follow the PA 2272 administrative supplement to existing NIH grants and cooperative agreements. The instructions, they are all in the SF 424, and this is all described in the application. I'm just pointing out a couple, you know, based in some of the doubts and questions that I had seen before. Also, in these administrative supplements would only be related to the codes or grant listed in the announcement. That varies from R01s, R21s, P01s, P20, P30 that are the cancer centers, US2, and all they listed here. No other, if the grant is not listed here, it means that you cannot do this supplement. Also, in terms of the eligibility, very important, it has to be a grant that is not in its final stage. If it's already in an extension or would need an extension to be eligible, since this is for fiscal year 2022, we won't consider the supplements. Yeah, in other words, no cost extension of a parent grant or cooperative agreement will be allowed to accommodate this supplement. Other question that I heard more than one time, it's only one supplement application per grant. You cannot do 2 or 3 per grant, only one. And very importantly, what would be the criteria to be considered in the review of the different applications? Well, we would look, we would look at the relevance of the parent grant and the original work scope. We also will look at how this study add or enhance a different research gap related to global integrative oncology. If the proposal is appropriately justifying for the focus in global middle income countries, and how the proposed study will appropriate justify in case some people are trying to make a connection with the study of data or people from low and middle income countries and try to find a relevance with cultural similar populations in the US. So you have to try to, if that's the approach you want to take, you know, you have to try to justify how we will improve the cancer prevention or the cancer care in this case. Again, this is a global award, so we want to see that you demonstrate in a reasonable way what is your access to the appropriate population and data sets. And of course, is the rigorosity in scientific terms of the study that address the needs of the target population. And also very important, as in any other application for NCI, you have to demonstrate the feasibility that you will be able to accomplish the project goals that you are presenting within the time, which is a year, and the budget that we say before, it would be up to $125,000 in direct costs. So I think that's in general, and as I mentioned from the beginning, some of the things that we would like to clarify based on the different questions and messages that we have received. But now we would like to open for other questions or clarifications that you might have. So feel free to participate. I should say also we are recording this presentation for those, and I would be available in case some people were not able to join. Any questions? Mark, do you want to say something before we go ahead with the questions?
No, I think you covered it all well, Alejandro. So happy to have questions from folks. And I believe people can also put questions in the chat too, or raise your hand. So yeah, feel free to go ahead. It looks like we have a question from Jeff as well.
Yeah, hi. This is Jeff White. I'm the director of the Office of Cancer Complementary and Alternative Medicine in the Division of Cancer Treatment and Diagnosis. And thank you for that tremendous presentation, Alejandro and Mark. I just wanted to say, you know, we certainly appreciate the involvement that we've been able to have with this project. And as you were presenting the potential the examples of potential research, it just sort of occurred to me that they were very much focused on treatment and prevention. And I just wanted to throw out that even though I don't think there's any mention of diagnostic studies or things that would look at biomarkers or ways in which traditional medical systems might categorize patients in unique ways, that I don't think that was intentionally restricted from this initiative. I just wanted to let you comment on that. I think somehow it just didn't get, put in as an example. Would you agree with that?
Yeah, it was not put as an example, but as I mentioned before, this is just example, and in any way, and I think in the announcement, it's very well clear, it's not a necessarily restrictive or comprehensive, so we will be open, if it's related to both to low and middle income countries and also in connection with the parent grant.
Yeah, because the strength of some of these traditional medical systems, one potential strength could be the way in which they assess patients and the unique needs of the patient based on I think there is some mention about physiology or the approaches to physiology. So, and then that's often an important way, I think, for conventional physicians and researchers to start having dialogues with traditional medicine, trying to bridge these gaps with regard to the way in which the patient is viewed. So thanks for that clarification.
Can I ask a question? Thank you, Dr. Sirakrab, for the observation. This is Karamel Bayumi. I'm from Penn State Cancer Institute. My question is regarding, everything is clear, but regarding the budget of $125,000 for a year, and if we're going to get a collaborator who's going to be involved from day one to the end of the study, and even if you propose a limited clinical trial to test a specific hypothesis, you're going to need resources, you're going to need a nurse, you're going to need a collaborator in the lower middle income countries. So that's why I'm thinking, how can $125,000 cover something like this?
Well, Mark, do you want to take that one, or?
Well, I can. Yes. No, I think you're right. The scope of the research that can be conducted under a one-year supplement like this with a limited budget is going to be limited. We don't necessarily anticipate, mounting a new clinical trial would likely require additional time as well beyond the 1 year period of this award. So I don't think we're really envisioning that's going to be realistic under this opportunity. I think you're correct. The scope is limited, but the goal here is to be able to foster some sort of innovative early stage research, which hopefully then could lead to maybe a larger, funding application down the road.
Right.
I really fully understand this. The clinical trial, you can have a window of opportunity, which takes 3 months, 4 months. It's not going to go beyond 1 year. Again, would require personnel to do specific things within the clinical trial. I'm not even talking about resources in terms of supplies, in terms of, traditional medicine to buy, whatever it is. All of this is going to be very costly.
Yeah, but, as I say.
I know the RFA says 125, nothing can change. So, but, I'm just thinking about the feasibility, because, whatever it is, even if you want to, study pharmacokinetics, it's going to take few months to get people around and have people really to arrange this trial and buying materials and the analysis of the outcome. So even though it's a limited duration, but it's going to be expensive.
So in those cases, I think, as Mark mentioned before, let's start with this, see where we go, and maybe this would be an opportunity to open larger funding opportunities. There is some questions in the chat that we would like to address. Yes, I think I mentioned that the upper middle income economies will be allowed to participate. There was a question about the citizenship or legal status for the applicants. The applicant will be people that have, already an NCI grant approved, and then the others, the persons that will work with from low and middle income countries, there's no any citizen. If you are referring to a US citizenship, that's not required for the people from lower income countries. How many?
Yeah. Can I just add to that, Alejandro? So I think it may be helpful. So just to clarify too, so there's the NOSI announcement, which is relatively brief. And then there's a link in that at the top of that announcement that links to where it says related announcements, that links to a longer announcement around a sort of generic administrative supplement announcement. And that has a whole host of other sort of instructions around eligibility and requirements. And yeah, if you look at that, it does state that under eligibility that foreign investigators, foreign institutions are eligible to apply. And so, yeah, so as Alejandro said, yeah, there's no citizenship requirement.
There's one, is the specific aims page included within the 3-page research strategy, or should submit it separately? I think they can be presented together, right, Mark?
Yes, that's right. So I guess the question here is that included within the page limit? Generally, that's a separate, generally you're allowed 1 page for the specific aims, independent of the sort of 3-page research strategy.
Yeah, so this was a question from Dr. Constance. So they will, you can include the specific aims and then the 3 pages. How many administrative supplements do you expect to award? It would, we are not sure yet. It will depend, on what we receive. We hope to, depending on the strengths or the relevance of the study, to support as much as possible, but we are not completely sure how many at this time. And let me see if there is any other questions. Any?
Can I ask
any other
question?
Sure, of course.
Hi, this is Angela Murphy at the University of South Carolina. And preclinical work, is preclinical work not allowed?
Like, for instance, what are you referring to?
So animal studies, does it have to be clinical studies proposed in the supplement?
Mark, what do you, I think it would depend, right?
Yeah, well, I think, yeah, I mean, I guess we haven't excluded that specifically in the NOSI. So,
okay.
Yeah.
So the aura ones I have are preclinical, but they are related to complementary and alternative medicine.
Okay.
So I pivot and do something clinical, but just wondering what my options would be, because both aura ones are preclinical.
Yeah. So I think
it seems like I can apply.
Yes. Yeah.
Okay, but should pivot to doing some clinical work.
If possible, yes.
Yeah, so I would suggest, yeah, you may want to talk separately with Alejandro and Jeff or others, as well as your program director for your parent grant, before submitting, just to make sure that what you're specifically proposing, fits.
Excellent, thank you.
Yeah. It's hard to give a broad answer to that. Yeah.
No, I understand.
Details.
And actually, that's something that I had proposed to some of you, and I want to reiterate that it's important that you talk to your program director about, what you are trying to do. With he or she will say that I can clarify a lot. Yeah, I will clarify related to this particular supplement, but I think since you saw in the presentation that it has to be complementary, you want to make sure that he or she are on board.
Yeah, so, thank you.
You're welcome. Any other questions or clarifications that you might need at this point?
So I have a question.
Yes.
I would like to know where can we find the exact instructions, like when we look at PA 2027 or SF 424, I feel like I'm going in circles and I'm not able to find the exact form that needs to be filled out for this. application? For example, how much information do we need to provide for the partner at LMIC? So where can we find the instructions?
In terms, what you need to do in terms of the partners is to clarify who will be your partner and how you intended to work with them and how you will distribute the work. Also related to the budget, as in any other application or supplement, you can explain how you would distribute the budget in terms of your collaborators in low and middle countries and so.
Okay.
So, yeah, I would just advise if you have someone on your team who's experienced with sort of going through the application process, definitely rely on them because it can be complex if you're not familiar with the process. I guess we're expecting, since these are supplements to existing grants, that the parent grant PI will obviously have some degree of experience with this. But you can also feel free to reach out to us, to Alejandro or me, if you have questions about the process, and we can help direct you as well.
Okay.
Another thing that I have mentioned to some of the prospective applicants that have been in contact with us is that the low and middle income country participants, they have to be registered and have a DUN number, particularly for the funding part. So that's important. Some people were asking me about that, and we clarified that, but I wanted to reiterate again here. And Krupali, regarding to your question, maybe in your group mentioned to people that had experience with the NCI grant, but in terms of the supplements, I don't want to say it's the system is complex, but the supplements, are not, it will be 3 pages plus the specific aims. You need to have this, the scope will be the interface between complementary and traditional practices with conventional oncology. And then, what will be the work that you will be doing, how that add to the parent grant, what will be the role of the low and middle income countries, how this have an impact in global integrative oncology, and so on.
Okay, no, thank you.
I have a question.
Sure.
In terms of the budget, it's a budget question. If my university has an existing MOU with the LMIC institution, can we, rather than going through the process of, with this budget, paying the institution directly, can we pay it through an existing MOU? Is that making sense? So it would still, it just financially and administratively, it would be a lot easier if it can, because there's already an exchange of funds going on between these two institutions, and structures are already set up. And again, for such a great amount, but for a limited time frame, it's logistically a little easier if you can implement this under an existing MOU. Is that possible, or does it have to come? Do we need a subcontract with exactly, that the funds are going to go from this grant to the designate outside party versus through an internal MOU that ultimately it goes to the same place? It's just the mechanism of getting there is different.
I think that's a good question. I'm going to answer from my point of view, but Mark, feel free. I think that would be possible because one of the things that we are looking with these supplements is to enhance existing relationships in case that, it could be a brand new, but also enhance existing relationships. So if it's a mechanism where you can have and will help to promote the work here, I think that's fine. Do you see any restrictions, Mark, that I'm not aware of?
Yeah, no, I don't. So I mean that's a important question. So I don't know the answer off the top of my head. So this is probably a question for the grants Office of Grants Administration folks who deal with the sort of budget side. So we can try and get an answer for you just to make sure that we're not missing something here.
Yeah.
Okay, I'll email you then directly. But thank you. That's great news, actually. Thank you.
Okay.
Good morning.
Good morning.
Good morning.
Hi, Dr. Calderon.
Hi, I'm Angela Calderon from Auburn University. I have a question because this MOU was mentioned. So do we need to have one in place before the submission or during the submission of these applications? Do we need to have one in place at the moment of the application?
No, if you think that will enhance the, but that's not a restriction to have a memorandum of understanding. You can, as long as you describe well what is the relationship with your partners in low and middle income countries, what would be their role, how you would work together, that's fine. We don't need a protocolary memorandum of understanding or letter of intent or anything like that. If you have it and you want to say that this is a good example, have you been working through the years, that's a different story and that's also fine. But we are not requesting that you have to have a memorandum of understanding to be able to work, to collaborate scientifically here.
Yeah, because we have one, but expired. We need to,
okay.
Update it. And another question is because our partner internationally asked about the indirect cost rate, and they don't have a fixed one in that institution. So I wonder if there is any suggestion on that. Because I asked in my sponsor programs and they suggested to tell them 10%, which because they don't have any percent, well, indirect cost rate. What are your suggestions in that regard?
Well, so I can add, so generally actually indirect costs for foreign institutions are limited to 8% at NIH. So it's different than for US institutions. I realize that may not sound very equitable, but that's the policy currently at NIH. So, foreign institutions are held to a sort of, a specific indirect cost rate.
Yes.
And then I would just say to answer, just to add to your other question, you would be expected to have some sort of, arrangement with the LMIC partner, either, a subcontract or something. But as Alejandro said, that doesn't need to be in place before the application. That's something that could be, put in place, later. But you want to be able to at least describe how that's going to work.
Any other questions or clarifications that you might need at this point?
Oh, I'm sorry. I have another question because this international partner asked us for some assistance in the process of guiding them on the registration. They have the DOMS number, but they are working on the registration in ERA Commons and then the SAM registration that is needed. So the SAM is needed at the time of the submission, as well as the ERA Commons for all the investigators from the foreign country. Am I correct?
Yeah.
So, Alejandro, do you want me to answer? Well,
yeah.
Some of the registrations in the system can take time. So we recognize, so it's not necessarily required to have all that for the application. Being registered in the the EAR comments is helpful, but some of the other registrations take longer.
Yes.
So we recognize people may not have that all in place at the time of application, and that's okay.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov/global health, 1-800-4-CANCER, produced April 2022.